Good evening. Thank you very much for joining us on our webinar that's on transition from a junior doctor to a specialty doctor or a surgeon's role. So just to introduce ourselves, we are two of us on the panel. Myself, Vinita Shekar. I am specialty doctor in oral and maxillofacial surgery at Nine Wells Hospital in Dundee. I am also co-chair of RCS Forum at the Royal College of Surgeons of England in London. Within my own health board, I am SAS Educational Advisor for NHS Tayside. And if I know the rough count, we are about 129 doctors and dentists in our health board. I'm going to introduce my fellow colleague, Ms. Beryl D'Souza here. I'm going to let her introduce herself, and then we will talk about ourselves just for a couple of minutes to give our backgrounds in regards with where we started and where we are now.
Okay, thank you, Vinita. So my name is Beryl D'Souza, and I'm a plastic surgeon. So I'm a specialty doctor in plastic surgery at Chelsea and Westminster Hospital. And I'm also an honorary senior lecturer in plastic surgery at Imperial College. And my other role is an associate postgraduate tutor for Central and North West London. And of course, I'm an SAS Forum member, and Vinita is our co-chair. As Vinita said, would like to introduce myself, and I'll just tell you a little bit about myself. So I started off my medical career in biochemistry, and following my degree in biochemistry, I then went on to do a high degree, a master's in philosophy in human anatomy and morphology at Royal College in this building in the anatomy department. And following my research degree, I decided I wanted to do plastic surgery because my research degree involved peripheral nerve regeneration. Having chosen to do plastic surgery, I started off as a general surgeon and then went on to apply for plastic surgery training roles. I wanted to stay in London because when I started to apply for SPR roles, I had had my first child at that time, and I did some of my training as a part-time trainee and carried on as a registrar, but then decided ultimately to take up a specialty doctor role because it gave me job stability, and in particular geographical job stability, because I needed to stay in London because my husband was a general surgical consultant in London, and by this time we had 2 children. So this is about me, and I'm going to let Vinita introduce herself and her background.
Thank you, Beryl. So I am a dentist as a background. I qualified in India, and I came to United Kingdom to join my husband, who was hoping to pursue career in maxillofacial surgery. His first degree was dentistry as well, but he wanted to do medicine and do his fellowship exam. So I joined him, and while trying to support him while he was doing his second degree, I could not afford to do a training program job. So I had no choice but to become a specialty doctor in oral and maxillofacial surgery. However, because of my own ambitions, once he got into a stable training job on the South Coast, I went to Cardiff Law School and did LLM in medical law, and that opened lots of doors for me. And I think my management roles started the day I qualified as a law person. I was investigating officer for Doctors in Difficulty from the second day after my graduation from the law school for Portsmouth Hospital NHS Trust. While I was working as investigating officer, I was doing full-time clinical job, and alongside I was literally training myself, and I think learning from all my colleagues, from the cases I dealt with, the cases I came across, and that was very much early maturity within the profession. And following that, the journey has gone on with one management role to another. I have been clinical audit lead in the past. I have been clinical governance lead in the past. I have been on several committees within the hospital. I have represented on local negotiating committee. Currently, as I introduced myself before, I am as RCS Educational Advisor for the Health Board. I am RCS representative for my own association, for British Association of Oral and Maxillofacial Surgery. So the roles are endless and opportunities have been endless, and I can only thank my colleagues and my trainers, and I think that's about me. So following on from here, we are going to talk about what this webinar is about. So in this webinar, we are going to talk about what are the challenges within the role, or while we are taking a transition from being a junior doctor to a specialty doctor, and how to deal with those transitions and challenges, alongside making use of opportunities and resources within your own hospital, the Royal College, the deaneries, and external institutions who can help us all. So the background, who are RCS grades? We keep saying we are RCS grades. So RCS grades are staff grades, associate specialists, and specialty doctors. Until 1965, we were called as medical assistants. However, in 1965, they introduced the title of associate specialist grade. Following on, because of the workforce problems, in 1988, they introduced the new title of staff grade. And for a long time, for almost 20 years, they were known as staff grades and associate specialists. However, with the modernizing medical careers and other changes in the political arena and educational arenas, they introduced a new contract, which was RCS contract. At this point, all new appointments were called as specialty doctors or dentists. The only associate specialists on the old contract could retain the title. So that's about why we are called as specialty doctors. So I'm going to hand over to Beryl.
Okay. So as Vinita and I have talked about our reasons for becoming specialty doctors, on this next slide you'll see other reasons for choosing this role. So some people probably want to choose it to use it as a way of having a portfolio career, so doing other things, maybe outside medicine, non-clinical things, in conjunction with their clinical role, and taking on the title and the role of a specialty doctor will allow for this to happen. Or you might want to work in a subspecialty that suits you within the specialty doctor role. So, for example, I have now moved on to a new subspecialty, and I do a lot of work in skin cancers, which is not what I started off with. There is always the work-life balance and trying to optimize that. And so with a specialty doctor role, you have more control over what you would like to do, because there are some jobs which expect you to do an on-call, so to sit on the on-call rota, and for some jobs you're just working literally daytime hours, regular hours, 9 to 5, and so for that reason the role of a specialty doctor is an attractive choice. This role will also enable you to gain experience and make you decide as to whether you then want to go back into a training post. So it could be used as an interim role. But as we've both said, it does give you control of the geographical location, because you won't have to be rotating within a deanery to all different hospitals and different locations if you take up such a role, because you'll tend to be fixed in one trust, or one trust with a few neighbouring locations to provide the clinical work.
So if we talk about challenges, what are the challenges one can face while trying to move jobs as junior doctor to a specialty doctor? So number one, I would say is variation in experience. That can come from your exposure during your junior doctor days, how much clinical exposure you have in regards with clinics or your hands-on work, what area of the clinical practice you're trying to do a job. Again, one of those areas you can have a big challenge. Challenge also in regards with where you think comfortable to start or you're comfortable while you're settled in the job. And at the same time, you can ask yourself, do I need more training in this? If yes, how do you take ownership of your training? Who should guide you? What should guide you? And where do you seek help if you have any training needs? If you have any training needs, how do you define your roles and how that role will fulfill the goals you may have? What direction you will go and how do you develop that direction and how will that help you making a decision in regards with what you want to do next or whether you have done what you need to do to fulfill that role. And all these things will enable your progression as you go along one year after the other within your own role. Beryl, do you think you have anything you want to add to this in regards with challenges? Because every specialty doctor, in my opinion, have their own challenges. The challenges are very wide in regards with the background you have come from or a team you're working with.
Yes, I agree. And I think that the challenges are quite personal. So it depends what you would like to do. And once you have taken on such a role as a specialty doctor, you can expand and you can choose to subspecialize, but you have to do that in conjunction with what is going on in the department. So there's a lot of negotiation to be done within the department with where the work is needed, because part of the work you would need to do is the clinical work. It's the work that's paying for your job. But as far as progression is concerned, this is where you will need to be proactive and work towards trying to decide what you would like to do. So, for example, my challenges of the last couple of years has been taking on an education qualification. So I've been working towards my master's in education. So that was a self-made challenge, but for me that was progression on an education front. So I think this is where individuals need to have a vision as to what they would like to do, but it's not a vision that you have on your own, but this is where you need to seek advice and help and speak to people. And hopefully the committee such as ours would be an avenue where you could approach and ask for help and speak to others in your own department or in your trust as to what you would like to do. But looking around you to see what's available, it would be tragic to think that as a specialty doctor, all you do is go to work and do the job and go home, because that's not what medicine's all about. We are so privileged to become the doctors that we are, and if we are to enjoy what we have worked so hard to achieve after medical school, qualifying, we should work towards trying to enjoy our career and seek different facets to our career to make us all-rounded good doctors.
So if one have to ask, where do we find guidance on education? Who do you approach locally? When I say locally, it is around you within the department or within the hospital you're working in. So for me, the first point of contact is always a clinical lead. Get to know your clinical lead. Tell them about you. Make sure they get to know you, because it is a partnership within the department and within a team that makes a successful clinician. Use them as your mentors. Don't give them a choice. That's what I have done. Do not give them a choice. Tell them they are your mentors. Now, mentors have various definitions and various meanings. It is what you make out of that definition. and what suits you better in that role. So please do get to know your clinical lead, because they will guide you what you need to know as a team, or what the team does. Because don't forget, you are new to the team. While they're getting to know you, you need to get to know them, and you need to work the way team works the best. Do not try to change the team at an early stage. Change yourself. Easy to change yourself than changing people around you. So that's my top tip, I would say, with my own experience. So who else can help you? SCS tutor. So you do have an assigned SCS tutor within your trust or within your health board. They are appointed by the deanery and by the director of medical education. They are responsible to help you, to guide you in developing you. That development can be clinical and it can be non-clinical. So make sure you know who your SCS tutors or educational advisors are. In England, we call them SCS tutor. In Wales, we call them SCS tutor, but in Scotland, we call them educational advisors. Now, another person you can speak to is your own representatives within your own specialty. Get to know them, email them, introduce yourself, ask them what can you do in your early years, what they have done when they were at your position. Go to your websites. All specialty associations have their websites. Make yourself familiarize with them and make sure you have looked at each and every option that may be available for you. You can speak to the SCS representatives on the SCS committee of your own respective Royal Colleges. They can be big help in guiding with educational resources. Resources within your hospital. Another one is Director of Medical Education Office. They will guide you in regards with the resources provided by the deanery and by the hospital leadership and management team. So get to know your resources, which are free, which are easy to approach, and they are the best resources you can have around you. Do you agree with me, Barry?
I do agree with you, and I think what you said about mentors and clinical lead, something else I would say is make sure you have sponsors as well. And a sponsor is different from a mentor. A sponsor is someone who believes in you, someone who will support you and work with you when you want to try out new roles, when you want to apply for new jobs, or you want to sit on different committees, someone who will actually support you through with this. So someone who acts as your reference, but someone who will actually tell you what's good for you and push you to move to this thing. There's always the thought that in a specialty doctor role, you're limited with what you can do. And as you can see, Vinita has pointed out all the different committees she's on. And that so just goes to show that it's, there are things out there that you could put yourself forward for. And hopefully with this webinar, we will be showing you what is available, and we'd like you to put in questions as well as we go along, because we'd like to be able to answer questions at the end of the webinar and address any specific needs that you have with the questions you're going to ask. So the things that will approach it that will be useful for you locally would be the list as shown, but also to identify people who will sponsor you as well.
So again, continuing on the same topic, guidance on education, you have your own external bodies who can help you. You are registered with either GMC or GDC. They have huge amount of resource on their websites. You're expected to know that, so get to know that, read them. Bedtime reading is always good. Defense Union websites, it is an obligation for you to register with the Defense Union while you're working in the hospital. So get to know their resources. You have Academy of Medical Royal Colleges. All Royal Colleges have partnership with the Academy of Medical Royal Colleges, and they have huge amount of resource within their website. You are associated to a specific deanery. They have huge amount of resources. You have Health Education England, which literally dictates what we should be doing. So get to know that. National Health Education for Scotland, they have lots of resources for SCS doctors that will be useful for people who are working in Scotland and for people working in Wales. Health Education and Improvement Wales have huge amount of resources that helps the doctors. So other than guidance on education, you are on a job, you have a contract with a hospital, you need to know what your contract involves. If you do not know what it involves, you need to speak to your local negotiating committee within your trust. Each hospital has a local negotiating committee and it has a representation of British Medical Association. You need to know what your job contracts are, what your obligations are, what you can expect of your employer and what your employer is expecting of you. Get to know your increments and thresholds. Increments are where you show your annual progression and you get paid by proving that you have done what you're expected to do. Whereas thresholds are every 5 years or 8 years, which generally shows that you're progressing not just clinically, but you're also progressing professionally. Do you have anything to add here, Beryl?
So the British Medical Association is our trade union as doctors, and this is the organisation that will help you with your job contract. And I think as doctors, we're not very good at looking at job contracts per se. We don't read the fine print, and it's really important that someone reviews that for you very carefully, especially now with all the fiasco we're hearing about pensions and so on. So this is something that you do need to pay attention to, especially as well if things are changing within your trust. If you are not aware of the local negotiating committee in your trust, go and find out a little bit more about it and find out who the SAS representative is on that local negotiating committee, because if there are issues that are affecting you, this representative will be able to act on your behalf, because the local negotiating committee consists of your trade union rep, the BMA, but it also consists of the HR in the trust, the management in the trust, and other doctors in trust, such as a junior doctor, as well as a consultant rep, an academic medical doctor rep. So these all comprise the committee which actually look at what's going on in the trust, what's affecting things in the trust, such as sometimes discussion on car parking or on study leave or on on-call payments or on-call commitments. But these are the sort of things that could affect you. So pay attention, because on this front where your job contract is, this is something that needs to be got right in order for you to get your monthly income. And you need to be quite aware of what you're being paid and the taxes you have to pay and the pension you're going to get and when you're going to get your increments and how you need to progress to get your threshold. But this is where you need advice.
And also we need to remember is the local negotiating committee has the right to make decisions on your behalf and negotiate with the management to make sure they are implemented what's best interest for you. So talking about SS contracts. So what does contract mean? There is a BMA e-learning module, and I think that's a very good resource. Carol, do you agree with me?
I do, yes. And that will just give you an idea, and we could add the link to that. I think it's there at the end, isn't it?
And often there are some terms you come across when you take a specialty doctor job, which is DCC. DCC, or direct clinical care. This is where you're in a direct contact with the patient. It doesn't have to be physical. Can be in the form of you signing a letter or you dictating a letter or you talking to a GP or a dentist. Then you have your supporting professional activity, which is more of what you do around your clinical work, what supports your clinical work. So it can be your own education, it can be teaching, it can be training. Sometimes we do accept extra work on top of our contract, what we are contracted to do. So we, in United Kingdom, we do follow European working hours, which is 48 hours per week. So if you're doing more than 48 hours per week, we call it additional professional activity. And then you have additional NHS responsibilities. So anything you do outside clinical work, say you're on a committee, you're a clinical governance lead, you're a clinical lead. So any management role you take within the NHS is called as additional NHS responsibility. Then you have external duties. External duties are if you're representing on a trade union, if you're working for the Royal College, if you're working in any outside organization, that becomes your external duty. So there is a certain balance you would want to know and progress. But in the first few years, I generally say concentrate on your DCC and your SPA if you need, you can do APA, but at the same time, keep in mind that you might want to think about additional NHS responsibilities and external duties. So, SAS Charter, I'm going to hand over to my colleague, Beryl. What is your opinion on SAS Charter?
So, the SAS Charter was brought out a couple of years ago by the BMA SS Committee, and it's really a document that was put out, and it was put out in collaboration with NHS employers, with Health Education England, and the Academy of Medical Royal Colleges. And the whole point of that charter was to ensure that there were certain things adhered to for SAS doctors, primarily to progress, I think, in my opinion, and to ensure that their job contract would allow them to do so with the various parts of the contract needed for that. And our next slide shows that. So it's really looking at the conditions of the employment and what's needed for you to go through appraisal and what's needed for you to go through sort of professional development, and how you could be supported to take on management roles as well. In the past, when revalidations first came out, I think the SAS doctors were the last doctors to actually go through the process, but now it's very much embedded, and part of that has involved the need for a charter to ensure that the rights, I think, of the SAS doctors are taken into consideration by the trust, and for that, it also includes ensuring that there's the annual leave. If you're of senior enough status, your annual leave is equivalent to a consultant number of days leave. So this is something, and the document is out there, and you can have a look at it. And most trusts have signed up to the SAS Charter, and that's what the BMA is striving towards through the L&C committees, to ensure that trusts sign up to that charter, because that means that trusts are engaging with you as SAS doctors to ensure that they're looking after you, to ensure that you as an employee are being supported and working through, and you're being developed as well as a doctor.
You're absolutely right. And I also want to highlight here is that all 3 nations or 4 nations have a very little difference in SAS Charter. So if you're working in Scotland, please do read what is applicable in Scotland, because commonly, most of the things are quite common, but there are very subtle differences in each nation, how they look at it. So now, talking about study leave, study funds, educational funds, we are very privileged compared to the trainees and the consultants in regards with our funds and how we are supported for our education and development. So we get on average 10 days per annum, or we can have 30 days for 3 years. And you can roll over and do as it suits you better. So you can take all 30 days in 1 year, or you can distribute your 30 days in 3 years. And same thing goes with the funds. However, study funds vary from one trust to another. So get a clarity from your study leave coordinator in the hospital, how much you get every year, and then you can plan your events as and how it suits you better. You also have access to SAS educational funds. They're exclusively for SAS doctors and dentists, given by the deanery. They are guided by the SAS tutors, and again, hospital to hospital, they vary how much you get, and it is not a certain amount, fixed amount every year. It changes year after year. So get to know your funds, plan them well in advance, and your SAS tutors and educational advisors in the trust and health board should be able to guide you on this. So that's one reason you have to get to know your SAS tutors and educational advisors. They're very crucial in you getting access to these funds. So now we talk about what is the key to your personal and professional development. We do have resources, we have mentors, we have advisors, we have supporters, but then how do you utilize them? So for me, there is a cycle of your professional development plan, your job planning, and your appraisal. Now, 3 things are interlinked. They do rely on each other, and you have to be very, very clever in how you use each thing influencing the other part. So if you think about your professional development plan, Remember, it is your personal development plan. It is not dictated by someone. While it is your personal development plan, you want to think, what is the service need? So try to have the right balance, what's right for you and what is right for the service you're trying to provide. So speak to your clinical lead, speak to your clinical supervisors, if you have an assigned clinical supervisor, and create a personal development plan. You should always have a balance of something clinical, something non-clinical, something into the leadership or management roles, or something that is very close to your heart. So it can be a number of things, but be realistic what you can achieve in that particular year. Your professional development plan is for 1 year, and then you can move on to next year as and how the appraisal is done. So your personal development plan is part of appraisal. When you have yearly appraisal done, you're expected to have a professional development plan. Once you have professional development plan, you can influence your job planning, because the job you're doing should support your personal development plan. So you can see how the links are working with each other. Your job planning, again, is linked with appraisal, because your job planning tells how well you're doing. And if you're doing well, your appraisal is going well. So you can see there's a cycle between 3 of them where one influences the other. So be very clever, be very thoughtful, and be inventive. That's the key to personal development plan here.
I agree, and always think for the next year. And the point you made about being realistic, knowing you want to achieve. So don't go for really something that you're not going to be able to do in a year. And this is where at appraisal, your appraiser should be able to guide you as to what you can achieve with that 1 year. Because you want to, when having 3 or 4 strategies to use for that year would be something that you should be thinking about and working towards.
And obviously, all this planning will help you in creating what is necessary for attribute of a good doctor or a surgeon. So proper planning, proper appraisal, proper job plan will give you and flourish you with appropriate clinical skills as needed for the service you're trying to provide. You will not be educating yourself, you will be an educator for people around you. Learning is a two-way stream. While you're learning, you're teaching as well. You're a leader, you're making decisions about patients' health and patients' treatments. That makes you a leader. And you're teaching your junior trainees. You're a mentor for your junior trainees, because they look out to you how you're behaving in front of your patients and your colleagues, and you're a role model for them. So you can see you're not only learning, you are influencing people around you. So be a good influencer when it comes to your professional and personal development. So talking about leadership and management opportunities, this is something you would want to think about as and how you get settled into your clinical work. There are a lot of opportunities. While you're working from day one, you're not only a clinician, you're a clinical supervisor for junior trainees. Remember, as a specialty doctor, you're a senior clinician. You are a clinical supervisor and you're a mentor and educator. Educational supervision, it is complementary to clinical supervisor role, but you do need training and you need some guidance. There are lots of opportunities within the deanery, within the hospital, and the courses provided by the Royal College here, where you can get the training and become an assigned educational supervisor. You could be educational supervisor to a junior trainee or a senior trainee, depending on your own roles and your own capabilities. Clinical audit lead, I have done it in the past. I have said before, it is, you'll be surprised how it influences your mind and how it motivates your mind. It is a quality improvement program, which you not only do it for the department, you do it for yourself. Audit and governance, they go hand in hand, makes you a better person, not just a better clinician. You could become a peer reviewer for the journals. It makes your reading habits better, and as you read, you learn. Research roles, lots of opportunities. It's not for everyone, but those who like to have research roles, there are lots of opportunities within the departments or within the hospital for research roles. You have particular interest in research roles, Beryl. I
do. So I think in surgery, it's really difficult to go for the sort of big randomized control trials, although it's possible if you're affiliated with a good research unit. But I think as surgeons, we can always start small with a case report, an interesting case report, or look at the work that we're doing. If we're doing a lot of the same work, then we can build up quite quickly case series. And with research roles, we can bring in junior doctors or work within the department to look at a particular problem that you have in the department. If you're seeing the same cases, you're seeing a lot of them, and you build up knowledge on how to treat the cases. And in that way, that can link up with quality improvement as well. So there's a lot that can be done on that. The peer review for journals is one way where you can increase your CPD, as well as look and see what's going out there in the research world with regard to the work that you're doing in your specialty. So that, and a lot of journals, and there's so many online journals now crying out for peer reviews, so have a look and see. It's a non-paid role, but it's work worthwhile doing in order to keep your professional development up to speed.
And just as an example, you know, many people come and ask me, what do you mean by additional NHS and external duties? So just an example of these duties, you could become an appraiser. When you're an appraisee, you're having yearly appraisal. So person who's doing your appraiser is appraiser. So you could appraise someone else. You could appraise your own colleagues, or you, if you're a senior in your profession, you could appraise even a consultant. There are no hard and fast rules. You could become appraisal lead, which is a very senior management role. You could be RCS representative for your own specialty, for local negotiating committee. You could be RCS tutor, advising and mentoring your own colleagues. Or there are several committees which you do get to know as and how you are involved in the clinical work or the wider workforce, and you could represent those committees. Other senior management roles, there are no restrictions to SAS doctors to become associate deans for SAS doctors. You sit in the deanery and you help and guide and educate your colleagues. You could be a clinical lead for the service. You could be a clinical director, associate medical director, or a medical director, or director of medical education. So you can see the choices and privileges are endless if you're really keen to develop yourself. In addition, you could have the teaching roles. If you're associated to a medical school, you could become a tutor or a lecturer in the medical school, learn criteria, educate yourself, do a degree in medical education, a higher degree, you could do a diploma, you could do a PhD, you can do MSc. So there are lots and lots of opportunities. Learning goes on all your life. You can teach within your own specialty. You could become an examiner. You could become an undergraduate interviewer, or you could interview your own colleagues. So there are endless opportunities, whether you want to think about management or teaching or learning. Now, Beryl has a specific interest in a certificate of eligibility for specialist registration, and I will ask her to say a few words.
So on our SAS forum here at the Royal College of Surgeons, we're actually looking at the CSER application process, because there are differences. So in your role as a specialty doctor, if you want to apply to sit on the GMC specialist register, there is a way to do so. And in order to do so, what you would need to have to put together is an e-portfolio showing that you are adequately trained. So there needs to be a log of all the evidence of your experience. So we're surgeons, so a log of all our operative work and a log of the clinical work we do per se in our specialty. And the e-portfolio that you can use, that's generic for all specialties, is on the link down below, the ISEP, so the Intercollegiate Surgical Curriculum Project. There is an e-portfolio that you can go on to. So the whole point of applying, you need to look on the GMC website to actually see what the application process is all about, and whether you tick all the boxes in that you can actually fulfill all the criteria that's needed in order to sit on the specialist registrar. And what might be needed is a secondment opportunity to complete training for that specialty. And this is where you are really seeking the support of your employer, so the trust where you work, as to whether they would facilitate, they would allow you perhaps to go to another unit to complete your training in that specialty, or even give you support to take exams, to take some leave for studying for the exams, or generally update yourself to finish the training. But when that all happens, when you've actually put your application in, what needs to happen is that you get the recommendation from the college in order for you to get onto the specialist register. What we do know is that there are differences with the various specialties as to sitting exams outside the UK, so the European exams, and so that is something that we're looking into, because we know certain specialties it's very easy to sit the European exam as an alternative to the UK exam, and for some specialties it's not, and so that's something else that we're looking into.
So just coming close to the end of this webinar, because we want to have enough time for question and answers. So just to kind of highlight, we are representing the SCS Forum here. SCS Forum has basically, SCS Forum is represented by all SCS doctors or SCS surgeons in the Royal College. We consider policy and make recommendation to the councils on the issues that are related to SCS surgeons. We raise the profile of SCS surgeons and we generate awareness about issues relevant to us. We represent our SCS Forum on committees and working parties within and outside the Royal College. We are 10 members. Two of us are co-chairs. One of them is Royal College Council Member, and there's one surgeon who is elected by the other 4 members. So that's how there are 2 co-chairs, and I am the elected member on the forum. The elected co-chair of the forum sits as an invited member on the RCS Council, and we meet 3 times a year. There are volunteer opportunities within the Royal College. So if you're a member, you have the privilege of becoming a clinical or educational supervisor. You can be a surgical tutor. You can be a MRCS party question setter. Now, if you wish to become a question setter, you need to email the link we have given here, and they can guide you with the criteria required to become a Part A question setter for MRCS exams. You can be update reviewed for the RCS library, which gives you a contribution to the monthly annals we publish from the Royal College. And last but not the least, you could be a regional director. So there are 2 vacancies at the moment. The link will take you to the person specification. So if you're interested, please do look at the link and reach out to us.
Vinita, can I just say for that one, for the update review, so each specialty gets an update from the college library, and the update comprises a whole review of what's come out in the journals on the topics. And so a group of surgeons, different specialties and different grades can apply to become update reviews, and there's always a need for that, and it's a good way of looking at journals in an enforced manner. to read up what's published.
So to finish the webinar here, the top tips from me is be creative with your vision, join the e-portfolio provided by your respective Royal College, take ownership for your own education, personal development, professional development, and seek out for the opportunities there around you. There are further resources here that can guide you and give you a bit more reading time and guide you what you need. And I think now I welcome all the questions and answers session here. So the first question is age a factor? Absolutely not. I think SAS grade is one grade that encourages any age group to come and join at any point in their life at all, because it is family friendly, and it kind of accepts you no matter what. And again, as you know, in United Kingdom, Equality Act 2010, no grade what you are in your service, age is never a factor. I hope that answers the question. So the second question, Barry.
Okay, so how do applicants from Africa improve their chances of getting a training position through clinical attachments, observerships, and so on? Well, I think if you want to train, if you're from another country and you want to come to the UK to train, the only way you can do that is to ensure that you can get provisional registration through the GMC, or you have a scheme with your Royal College whereby they can support you to look for clinical attachments in order to use that as a way to decide whether you want to come into this country and do training programs in this country. And I think this is a moving feast, because every time there are changes being brought into the system as far as visas are concerned and so on, because there are shortage of doctors in the UK in different specialties, and so there are always opportunities. So you do need to look and see what's available through the Royal College, and also to look at our governing body, the General Medical Council, to see what they actually allow for qualifications from overseas. And it's very clear what you need to do in order to come and work in this country. Now, clinical attachment and observership is very different, because you're not hands-on. You're not touching patients. So there might be opportunities directly with various individuals or various departments throughout the UK, and more as we're becoming more international in surgery, there are lots of affiliations with trusts from the UK with medical schools or hospitals overseas. So it's actually, as we keep saying, seeking out the opportunity and doing the homework and going and looking to see how you can progress. And people are very accessible nowadays. If you know of someone, you read a journal, you're interested in the author and the author's work, you can approach that, because there's normally a contact email address that you can use.
So next question is, what does the SAS Forum at the college do, and how can I get involved? Ben.
Okay, so the SAS Forum, as Vinita showed on the previous slide, comprises us of 10 members. So we have one Royal College Council member, and then we have a chair elected from our membership group, of which Vinita is the co-chair. And the group of us at the moment, the membership consists of there are two plastic surgeons, there's an orthopedic surgeon, and there are two max-fac surgeons, aren't there?
Yes.
And so we sit on the committee, and we only meet 3 times a year, but there is a lot of work done on email. So we try and address the various issues that are affecting SAS doctors. And one of the things we're doing as a forum is sitting here this evening doing this webinar to try and engage with you, to try and see what you want from us and how we can help you. And that's why we put together these slides to see, well, this is what you can do as a specialty doctor. So if you would like to get involved, and in fact, Vinita, tell them.
Email us. Give us a call. Write to us anyways. So as a forum, we are not only doing things, we are also communicating. Communication is a key to anything we do. So if you want to get involved, start talking to us. Tell us what you want us to do. Do not let us do what we think we should do. We would be happy to be guided by you, and that would be the best way you can get involved. And in the future, if you think you want to join the forum, there are vacancies arriving every 2 years or sometimes every year. Please do get involved. We do have vacancies at the moment. We will be advertising soon, so look out and please do apply for the role.
Okay, right. So this next question is, I'm a senior registrar of pediatric surgery in Cairo University, and I want to know what is the possibility to get a training post in pediatric surgery. I heard it is very difficult, competitive, and even more if I'm not British. Well, I think what you need to do then is look at the actual specialty association for pediatric surgery and find out if you would like to come over here to do a fellowship. I'm sure that's possible, but if you'd like to come here to train, then you need to find out from the specialty association as to what are the steps you need to go through to apply for a training post here in the UK, and at what level you would need to be applying for. So this is something that you would need to go into the specifics with this particularly subspecialty in pediatric surgery.
So next question is, what is the main difference in CCT and Caesar? Are Caesar pathways considered somewhat inferior to getting a CCT role? Now, the main difference in CCT and Caesar is CCT is a training program. You go through a training program. You have national training number. You have clinical supervisors, educational supervisor who guide you through the training, and then you sit an exam at the end of the CCT and become a consultant. Whereas for Caesar, you do not go through the formal training pathway, but you achieve your competencies while working through doing a specialty doctor or associate specialist role job. And then you apply, you create a portfolio. So as we spoke before, it is a very much portfolio route you take towards your exams. And I think I will ask Beryl to contribute to this a little bit because, as I said before, she has a particular interest in Caesar, and she's our Caesar lead for the forum.
So it depends what you mean, because as Vinita said, so there are various people choose to do formalized training, so they will use the CCT route, and people choose to do an informal training process where they go through a different training process through the specialty doctor process, so they would go through a Caesar route. So at the end of the day, if you are on the specialty register, then that is an indication that you are trained, and so you're fit to do the job. And so if you want to apply for a consultant post, and there are people out there who have got consultant posts in various specialties who have come through either the CCT route or the Caesar route. And I think in medicine, we're not inferior to each other. We have all been trained, so therefore we're all capable and able, and we rely on our own professional development to get better.
So next question, how to ensure more training opportunities, and what to do if I feel I'm not getting enough training opportunities? Now, it is very subjective in how you look at training opportunities and how do you get through them. Now, you have to be inventive. You have to take initiatives. You have to be assertive and you have to be very open-minded what you consider is a training opportunity or whether you think you're getting enough. I think it is very individual in how you look at it and how you achieve it. If you don't have training opportunity, create one. If you're a worker, everyone loves who likes to work. So I don't see why you should not get enough training opportunities. However, if you're working as a specialty doctor, we do not call it training opportunities. We use it as a service opportunity, but we create it and mold it around us where we train along the job.
I think if you feel, I think if you feel you'd like to learn more, or you'd like to learn, say, for instance, a special operation, or you want to learn more of the same thing, or you want to see different people do an operation, then invite yourself. to go along. So get in touch with the person you want to see operate, do a specific procedure, and say you'd like to watch them. Don't forget, surgeons get very flattered if someone wants to come and see them, or someone wants to talk to them about what they're doing. They love to talk about themselves. So go and ask if you can be trained politely, and see if they will do so. But look and see what you're doing. And if you do feel you're not getting enough, then you need to go out there and look for where you can get training. Don't forget, there is a lot that you can do that's freely available online as well. You can look at videos of operative procedures. You can look through journals and so on. But if you want hands-on training, you want to go and ask if you can observe. If you on your day off, go and do that. At weekends, you can go to a private hospital and see the same consultant who's working in the NHS, perhaps doing something, or in the evenings. It means getting out there and doing a little bit more. But if that's what you want to do, you want to be trained, then you need to go out and look for it.
And think outside the box. Yeah. Next one. Do you think international medical graduates would have a lesser chance of becoming a specialty doctor? I don't think so. If you think, I am international graduate and I had no problem, actually, that is a job which you do not have to wait for. You can easily become a specialty doctor, and while you're a specialty doctor, you can think at your opportunities of becoming a specialty trainee or finding a training program that suits you better. So actually, that is an entry program for many graduates while they're looking out for a training number or a specific training jobs. So I think you have a better chance of becoming a specialty doctor.
I think medicine is international, so for that reason, we all have opportunities to do what we want, and we can choose what we want to do. So I don't think you should have that idea that international medical graduates are more inferior. Okay.
So just kind of wanted to tell you about our upcoming webinars. Job planning is on 7th of November 2019, being chaired by Tim Mitchell, one of our council members. It is a very important webinar because in November you will all get an email asking you to do your job planning. So please do join us. We're going to have a good interactive session on job planning, what to do, what not to do, how to lead your own job planning. So it is a very, very important and very hot topic within your job throughout the year. And there is another webinar on the interview skills, which is in December. Chair is yet to be confirmed, but look out for this webinar. And then there's another event, Illness to Wellness conference. It is very good. Beryl was quite keen that we talk about health and well-being, but we didn't have much time. So maybe that's your opportunity to hear. If you get to see Beryl, you can have a personal conversation with her. And then we have joint RCS and FMLM Introduction to Leadership event in Friends House London in October. And surgery and the law in Newcastle. So we are traveling to Newcastle. Please do come and join us on the 14th of November. And if you're not a member today, please join us. Lots of opportunities, lots of discounts. Get involved with our work, represent your community, and guide your friends.
Opportunities to get involved, and we pointed out what opportunities there are at the Royal College of Surgeons. One thing we should say actually, Vinita, is that by default we're both women in surgery members, and there is a women in surgery network too. But rather than paying £15 all the time to join the webinars, consider becoming a member and benefiting from the resources available and events available.
And share your experience. So get involved. Thank you very much.
Thank you.